I'm Macy Spence.
And I'm David Wright.
Hello, my name is Summer Swift, and we are all students at Texas Lutheran University. This is a project for our medical terminology class. We will be discussing Chapter 5, the digestive system, the language of gastroenterology. The digestive system has primary organs and secondary organs. The primary organs are organs that only have functions within the digestive system. Secondary organs also have functions outside of the system. So the primary organs are the oral cavity, or mouth region, the pharynx, which is your throat, the esophagus, the stomach, small intestine, and large intestine. And the main function of the digestive system is to digest. So digest means to break down, and shun is the action of breaking down. We have 6 functions of the digestive system. The first is ingestion. Ingest means to carry in, and shun again is the action. So the action of carrying in food into the system. Propulsion is the movement of food along the cavity. Deglutition is to swallow. This is the first process of propulsion. And peristalsis happens throughout the system. Peristalsis is the around constriction of muscles that move contents through the system in a wave-like fashion. Digestion, the chemical breakdown into small organic molecules. This can happen mechanically or chemically. Mechanical is like chewing, and chemical is with the process of enzymes. Amylase, lipase, and proteases are all enzymes associated with digestion. Anytime you see ase as a suffix, that means enzyme. So amylase, amyl is starch, so enzymes that break down starch. Lipase, lip or lipo is fat, so enzymes that break down fats. Protease, prote is protein, so enzymes that break down proteins. Secretion, the release of substances to help lubricate the system. Absorption, the movement of nutrients out of the digestive tract into the blood. Little fun fact for you, when you swallow food and it's in your esophagus and in your stomach, the food's not inside your body. The nutrition in food isn't inside your body until it is absorbed into the bloodstream. A little bit of this happens in the stomach, but most of the absorption occurs in the small intestine. Elimination is unabsorbed residue is removed from the body through urination and defecation. So, food allergies is a disorder that occurs in the digestive system. It affects 6% of children and 4% of adults. The immune system overreacts to a food, giving you this allergy, and breaking down allergy, all is other, and urge is the process of working. The 8 most common allergies in humans are eggs, fish, milk, peanuts, shellfish, soy, tree nuts, and wheat products. Melena is another digestive system disorder. This is the passage of dark stools because you are bleeding earlier in the GI tract. And if you can see the dark stool here versus the normal colored stool here, the brown. The oral cavity is the first structure that food or nutrition passes into. So let's break down the structures. Palate is hard or soft. The anterior 2/3 is hard, and the posterior 1/3 is soft. And if you move your tongue along the top of your mouth towards your throat, you can feel the hard, and then it turns to soft. Teeth aid in mastication. Mastic is chewing, so chewing. The uvula is the funny structure at the back of your throat, and when you swallow, it swings backward, and it closes off your nasopharynx, so when you swallow, food doesn't go up into your nose. The tongue assists with mechanical digestion and mastication. The papillae are raised areas that house taste buds, but they're not taste buds themselves. But the taste buds help us taste the 5 primary taste sensations, which is sweet, sour, salty, bitter, and umami. Umami is like a mushroom, steak, meaty kind of sense. The salivary glands, we have 3 types. Parotid, beside the ears, parotid. So that means it's up here, kind of towards the ear. We have submandibular, which is sub is below, and mandibule is the jaw, so below and in line with the jaw. And sublingual is below the tongue. Below is under and lingual is tongue. Cleft palate is a disorder with the oral cavity. It's a congenital fissure in the median line of the palate. You can have only cleft palate, or you can also have cleft lip associated with the cleft palate. Then I'll pass it along to David.
Okay, the biggest thing of the pharynx is the epiglottis. Without the epiglottis, food will come down our windpipe and it will cause us to choke. So the epiglottis' main goal is to keep us from choking. The esophagitis is the inflammation in the lining of the esophagus. Usually when people vomit, the hydrochloric acid comes up to the esophagus and it doesn't have the lining like the stomach to protect us from the acidity of the hydrochloric acid. And this could cause problems, especially people who are bulimic and throw up after eating. The esophageal varices is like the deadly thing about it is there's no symptoms until it's too late. So once it's ruptured, like usually you can go to a doctor or something, but it's pretty hard to know what happens before it's too late. And cancer of the esophagus, usually this like the burning sensation and difficulty swallowing, like could be symptoms of other things, but weight loss should be a big one that you know that it could be cancer. The stomach has 3 layers. The whole alimentary canal usually has 2 layers of smooth muscle, but the stomach has an extra layer called the oblique muscle layer, and this helps with more churning of the bolus that's now chyme since it's in the stomach now. And the hydrochloric acid binds with pepsinogen and becomes pepsin, which helps digest the protein. So the duodenum's biggest thing from it is the bile salts and the digestive enzymes from the pancreas helps like digest protein, carbohydrates, and the biggest one is to the bile salts emulsify fats, help digestion and absorption becomes easier. A lot of absorption happens in the jejunum with the microvilli of the enterocytes, increased surface areas to allow for more absorption. It spends like 3 to 5 hours in the small intestines for more effect on absorption, and after all that is well and done, it moves into the large intestine. The stomach could have the gastritis, which is caused by ibuprofen, alcohol, smoking. This is why people need to eat food whenever they take ibuprofen. Ulcers happen when there's an absence of mucus in the stomach lining, and without that protective mucus, it can burn a hole through our stomach wall. Alias is like bowel obstruction or intestinal paralysis, which is caused by it. So it's people taking drugs that slow down the whole process. And the liver's biggest part is remove bilirubin. This is why whenever someone's liver's failing, jaundice happens. They get yellow and such. Uh, Excess glucose turns into glycogen. So whenever someone has low blood sugar, it's okay because they have that glycogen to bring the blood sugar back up. Proteins and fats can turn into glucose through the liver. And one of the biggest ones is to remove toxins from blood. So whenever it's like people drink a lot of alcohol, the liver does a lot of work detoxing the toxin and turning it into less toxic liquid. And that's pretty much it with my video. Thank you.
Next, we're going to move into disorders of the large intestine and the anal canal. We have diverticulitis, which is a presence of small pouches that bulge through the weak spots in the walls of the large intestine. A picture of diverticulitis is located on the far top right-hand corner. So we can see just the little pouches here of what looks like fluid through the lumen of the small intestine. large intestine. Next, we have irritable bowel syndrome, abbreviated IBS, presents with cramping pain, gas, constipation, or diarrhea. We have it here in this middle picture. It shows a picture of the bowel and then the abnormal contractions. It's just abnormal contractions producing pain. Can go all the way through the large intestine, even presenting into the rectum. Next, we have colon and rectal cancers. Majority occur in the rectum and the sigmoid colon, so this last part of the colon here, in this picture, and as well as over here, and the red part is actually showing the cancer. And then on the far left here on this picture, we can see a picture of the normal colon, and then we have the rectal cancer over here in this corner, and then even moving into colon and rectal cancer in the same one through a colonoscopy. Next, it is spread by extension through the small bowel, or it can metastasize and can move through the bowel, or it can move through the blood. Procedures and pharmacology of the digestive system. We have an enteroscopy, which uses a flexible video transmitter to visualize and biopsy tumors from esophagus, stomach, and even into the duodenum. The upper GI tract barium X-ray uses a barium swallow to contrast masses and bleeds through the esophagus, stomach, and duodenum, which will just give us a visualized view that we could not get just by the naked eye, and will also prevent the need for a colonoscopy or an enteroscopy. Fecal occult blood test are used to detect blood in the stool not visible by the naked eye, which is typically used for first screening for cancer of the large intestine. We also have angiography, is a dye injected to show contrast in blood vessels in the GI tract. Here we have a picture of enteroscopy showing the camera moving through the stomach and into the small intestine. On the right, we have the barium enema, which is shows the contrasted section with injected barium, showing all these masses throughout the large intestine. Some therapeutic procedures. A laparoscopy is a thin lighted tube inserted through an incision in the abdomen to examine the visceral organs, used to check and remove tumors, and can also repair hernias. We also have intestinal resections, where we surgically remove diseased portions of the intestines, and the remaining parts can be joined back together. We also have pancreas endoscopic ultrasound, which is abbreviated EUS, allows for detailed imaging and analysis of the pancreas. Next, we have gastrointestinal drugs, which are antacids, proton pump inhibitors, antiemetics, laxatives, or antidiarrheal drugs. Most of these involve treating vomiting. The antacids neutralize the stomach. Proton pump inhibitors are taken to suppress gastric juice secretion, which irritates also the esophagus. Antiemetics treat nausea and vomiting, motion sickness, and examples include Benadryl. Laxatives treat constipation, and antidiarrheal drugs, prevent diarrhea.
Disorders of the liver, gallbladder, and pancreas that affect digestion. Liver, hepatitis C, hepatitis B, hepatitis D, hepatitis E. Disease is characterized by inflammation of the liver. Gallbladder. Gallstones can affect the cholesterol, bile salt, and bile pigment. The stones can vary in size and number. Pancreas. Pancreatitis is inflammation of the pancreas. The acute disease ranges from mild to self-limiting episodes of acute life-threatening emergencies and severe abdominal pain, nausea, vomiting, and rapid full fail of blood pressure. Digestion of absorption, protein, carbohydrates, and fats. Proteins are large molecules that can be digested by proteases into smaller molecules called amino acids. Digestion can start in the mouth with gastric juices through the action of a group of potent enzymes called proteases in the intestinal lining of the pancreas. Digestion continues in the small intestines. Fats, some digestion occurs in the mouth and stomach, but most takes place in the small intestines. Bile is produced by the liver, stored and released by the gallbladder. It emulsifies the fat goblets into smaller droplets. This greatly increases the surface area of the small lipase and fat digestion pancreatic lipase into aid of the digestion. Carbohydrates. Digestion begins in the mouth, where the process of chewing mechanically breaks food into smaller pieces. Enzymes in the salivary uh, imitates chemical digestion. When you swallow particularly digestive carbs, travel down your esophagus to the stomach in a little addition of digestion. Malabsorption syndrome in the digestion. Malabsorption refers to the group of diseases which intestinal absorption and nutrients is impaired. Diagnosis of it is malnutrition, lactose intolerant, constipation, and Crohn's disease. Malnutrition is the lack of proper nutrients caused by not having enough to eat, not having enough of the right things to eat, or being unable to use the foods that one does eat. Lactose intolerance is the breakdown of milk, sugar, lactose, not being able to really digest it at all. Constipation is feces movement through the large intestine that is slow and causes much of the water to be reabsorbed by the large intestine. Crohn's disease is inflammation in the small intestine and occasionally the large intestine. Also may have delayed development and stunt growth. The anatomy of the large intestine and the functions. The large intestine is so named because its diameter is much greater than the small intestine. It is formed a perimeter in the abdominal cavity around the central mass of the small intestines. Its function is to absorb water from the remaining indigestible food matter and then the pass through useless waste materials from the body. The large intestines consist of the colon, rectum, anal cavity, and cecum. Conclusion. Functions and organs. Indigestion, ingest, carry on, ion, action, solid food and lipid into the oral cavity. Propulsion, movement of food, lipids from the oral cavity to anus. Dilution, dilute, to swallow, ion, action, peristasis, peri, around, stolus, contract, digestion, chemical and enzymatic breakdown into small organic molecules that can be absorbed, mechanical, chemical, amylase, starch, ase, enzymes, lipase, fat, ase enzyme, protease, protein, ase, enzyme, primary organs, oral cavity, pharynx, esophagus, stomach, small intestines, and large intestines. Secondary organs, teeth, tongue, salivary glands, liver, gallbladder, pancreas. Digesting. Digest equals breakdown, Ion equal action.